Hello, my name is David Margileth. I've been on the staff of St. Joseph's Hospital for about 35 years now. What we will be talking about today is what's called the BRCA1 and BRCA2 genes that, if they run in your family, can cause an incidence of breast cancer of up to 80% and an incidence of cancer of the ovary, which is often incurable, up to 40%. These genes are normal genes that function to suppress cancer. When they become mutated, that function goes away, and therefore we have cancers that develop in the breast and the ovary. Abnormal BRCA genes account for about 5 or 10% of breast cancer and ovarian cancer, and should be suspected in very young women with breast cancer, families with multiple members of breast cancer, any family with a male with breast cancer, and families with cancer of the ovary. One should then see a genetics counselor, and if the BRCA gene is present, one needs to consider breast treatment and ovary treatment. For the breasts, one can consider the most aggressive approach of bilateral mastectomy or close surveillance with MRI and mammogram. As far as cancer of the ovary is concerned, there is to date no evidence that anyone has a screening procedure, including ultrasound or CA-125, that will ultimately diagnose cancer of the ovary earlier and thus prevent death. Therefore, the only option with the ovaries in a patient with BRCA positivity is to recommend the removal of the ovaries and the fallopian tubes somewhere around age 35 to 40 or after childbearing has occurred. The estimate of people with this gene in the country is about 1 million, and so far we have found 20,000 women with this gene. So there's a huge opportunity to prevent the incidence of these cancers and ultimately death from these cancers by being more attuned to families that may harbor these genes. We would be happy to take any calls to our genetics department regarding your questions about yourself or your family. Thank you very much.